Hello everyone, my name is Belita D'Souza, and today I will be talking to you about a clinical decision support system for the monitoring and treatment of allergic asthma. Asthma is a chronic inflammation of the lung airways. Allergic asthma is the most common form of asthma. Allergic asthma is when allergens trigger the asthma symptoms. It means that the airways are extra sensitive to certain allergens which are inhaled. An allergen can be substances such as dust mites, animal dander, pollen, mold, and more. However, allergens are not the only thing that can make an allergic asthma worse. Irritants may still trigger an asthma attack, even though they don't cause an allergic reaction. These include smoke, air pollution, cold air, exercising in cold air, strong chemicals or fumes, scented products, dusty rooms, and more. If you are allergic to a substance, then this allergen triggers a response in your body where your immune system overreacts to get rid of the allergens. It releases a substance called immunoglobulin, which is IgE for short. Too much IgE can trigger the passages in the airways of the lungs to become inflamed and swollen. This results in coughing, wheezing, shortness of breath, rapid breathing, feeling of tight chest, and more, and it can trigger an asthma attack. So to test what causes allergic asthma, there are two methods. The first method is to prick your skin with a tiny amount of the allergen and to measure the reaction. The second method is a blood test known as a specific IgE or SIgE test. So why the CDSS in New Zealand? Well, for starters, it costs New Zealand $1 billion a year. 1 in 8 adults and 1 in 7 children take medication for asthma. New Zealand, along with Australia and Great Britain, have one of the highest rates of asthma in the world. And finally, it is to address the inequality in medical research amongst Pacifica and Maori people in New Zealand. Maori are 3 times and Pacifica people are 3.2 times more likely to be hospitalized than other ethnicities in New Zealand. So the details of the CDSS. This CDSS involves a smartwatch which is connected to a peak flow meter, which is an instrument that measures and records expiratory flow rate. In the smartwatch, users can download the CDSS app, which will monitor the pattern of the user's expiratory flow rate and send alerts and reminders for frequent measurement. If a pattern of low expiratory flow rate is recorded, warning notifications will be sent to the user to get checked by a medical professional. The user can also manually log in the severity of the signs and symptoms that they experience with the online food and symptom diary section of the application. If they are experiencing certain severe symptoms, the app will display the instructions to inject an epinephrine and the emergency number to dial, as this means that the user may be experiencing anaphylactic and needs to get an emergency room. Anaphylaxis is a life-threatening allergic reaction. So these are the instructions that will be displayed in the smartwatch for the user to inject an epinephrine pen and the instructions to take a peak flow meter test in which the instrument is connected via the app to record the expiratory flow rate. So this is the overview of the mind map, and we will be looking at the user's inputs, outputs, and processes separately. So the users for this allergic asthma CDSS will be the asthma users who have downloaded the app on their smartwatch and the medical experts, that is the allergists, GP, and nurses. Here we have the inputs. The patient data will consist of the age, name, ethnicity, gender, and patient history. The ethnicity data wants to look at Maori and Pacifica people in particular, as they are more likely to be hospitalized for this disease. The patient history looks at the family history of the patient to see who else in their family has asthma. They will also look at the previous IgE readings of the patient to find patterns of high or low readings. The allergen factors consists of viral respiratory infections, stress, exercise, food additives, weather, and irritants in the air, which include dust, pollen, and animal dander. Here are the symptoms which are related to allergic asthma: shortness of breath, skin rash, vomiting, and a sudden drop in the blood pressure. These symptoms particularly indicate a more serious allergic asthma reaction, which is anaphylaxis. And this is related to the process, which you can see in the blue line. It is to inject the epinephrine and then go to the emergency room. So then finally we have the data which is sourced from the smartwatch and the app with the expiratory flow rate readings, food and symptoms, heart rate, blood pressure, they are all recorded there. Here we have the processes. The process starts by the user downloading the application on their smartwatch and then logging in their symptoms. They then take the peak flow meter test to see if it's a high or low reading. If it is high, the user needs to get tested by an allergist to see if they are experiencing an allergic reaction. The allergists conduct either a skin test, where they place a small amount of allergens in your blood to see the reaction, or they conduct the blood tests. Both of these tests see how much IgE is produced by the body. This then takes us to the outputs. Just for your information, at the bottom, it shows another process that occurs if the certain symptoms that the user is experiencing severely. As discussed earlier, the user is likely experiencing anaphylaxis and needs to inject their epinephrine and needs to go to the emergency room. So going back to the outputs, if the IgE amount is found to be insignificant, then short-term medications are recommended depending on the severity of the symptoms to temporarily relieve the symptoms. However, if the IgE amount is significant, then there are allergic-specific treatments and general asthma treatments that the patient will go through depending on the type of allergy that the patient is experiencing. So general asthma treatments are categorized into preventers, relievers, symptom controllers, and combination inhalers. The allergic-specific treatments consist of allergy immunotherapy or biologics, which are lab-made proteins or antibodies that are injected into the skin or bloodstream. So since the CDSS involves a smartwatch and an app, the data is limited for the medical professionals to check up on daily food and symptom diaries, unless the consent of the data privacy is given to the user's local GP, for instance, for constant monitoring. This CDSS is also limited by the fact that it may not work for young children or old people who aren't as tech savvy to make best use of the application on the smartwatch. So right now the CDSS focuses on allergic asthma, which is a small part of the overall asthma. So if it is expanded, it can be useful for general asthma as well. Finally, because of COVID happening and New Zealand having one of the worst asthma stats, the CDSS would be helpful for them because it involves a smartwatch application that can be used from home instead of having to go to the doctor for every allergic asthma scares. So there'll be less doctor trips overall. Yeah. So here are some references if you want to learn more. Thank you for listening.